तो गुड इवनिंग टू वन एंड ऑल बेटा फटाफट ज्वाइन हो जाओ लाइव क्लास रे। मैं 350 क्वेश्चन नंबर जाए मैं कवर अप करथिले राइट ना। सो एनाटॉमी फिजियोलॉजी रे 350 350 क्वेश्चंस हमें पढ़ी सारी छे बेटा राइट ना। आज किसी क्वेश्चन अच्छी रही जाए एनाटॉमी फिजियोलॉजी रे ताको कवर अप करबा देन माइक्रोबायोलॉजी स्टार्ट करबा राइट। सो जो मैंने भी जॉइन हो जाए बेटा फटाफट वीडियो को लाइक कर दिया और शेयर कर दिया निज निज सांग पाखु जमती समस्त पाखे पहुंची पार राइट ना। तो फटाफट ज्वाइन हो जाओ हम टिके वेट करवा 1-2 मिनट वेट करवा बेटा तब स्टार्ट करवा राइट। ठीक है गुड इवनिंग टू वन एंड ऑल वंस अगेन वेलकम बैक टू आवर यूट्यूब चैनल नंदा नर्सिंग लाइव। सो बेटा आम महामाराथन क्लास चल हाँ ना नहीं जोटा OSSC नर्सिंग ऑफिसर रिक्रुटमेंट एग्जाम मोस्ट इंपोर्टेंट बहुत गुड़े क्वेश्चन जोटा प्रीवियस ईयर रो क्वेश्चंस गुड़ाक प्रत्येक टी एग्जाम रे आसी अछि प्रत्येक टी स्टेट एग्जामिनेशंस सेंट्रल गवर्नमेंट एग्जामिनेशन रे आसी अछि से सब क्वेश्चंस हम डिस्कशन करछे बेटा राइट। So these सब questions important for our upcoming OSSC nursing recruitment exam में बेटा। So OSSC nursing officer recruitment exam 2024 में most important ये सब classes बेटा तो previous classes सब जो मैंने देखी ना प्लीज ये सब वीडियो भी देखी ना वो यहाँ द्वारा तुम मन को हेल्पफुल है जो बेटा राइट। सो वीडियो को फटाफट लाइक कर दिया और शेयर मध्य कर दिया निज निज सांग मान पाखु जमती समस्त पाखे पहुंची पार और जो मैंने फर्स्ट टाइम चैनल को देखो बेटा निहाती भाव चैनल को सब्सक्राइब कर दिया प्लीज राइट। इट्स माय हम्बल रिक्वेस्ट टू वन एंड ऑल बेटा प्लीज सब्सक्राइब द चैनल एंड लाइक द वीडियो एंड शेयर द वीडियो टू योर फ्रेंड्स। सो लास्ट क्वेश्चन था 350 था नियर साइटेडनेस इज आल्सो नोन एज ऑप्शन ए था मायोपिया ऑप्शन बी था ब्रेस मायोपिया ऑप्शन सी था हाइपरमेट्रोपिया एंड ऑप्शन डी था कैटरेक्ट। सो मायोपिया मीन्स बेटा कौन नियर साइटेडनेस राइट नियर साइटेडनेस मीन्स myopia or myopia is also known as nearsightedness right ना। तो hypermetropia कौन बेटा hypermetropia तो presbyopia भी अच्छी hypermetropia अच्छी and cataract अच्छी। so presbyopia कौन बेटा presbyopia what is presbyopia this is the gradual loss of gradual loss of what beta gradual loss of eyes ability to focus what ability to focus on near objects ability to focus on near objects that is presbyopia right। So gradual loss of eyes ability to focus on nearby objects It is presbyopia. Then achi hypermetropia. What is hypermetropia beta? So hypermetropia, this is a conditions beta. This is the condition of the eyes where the image of a nearby object is formed behind the retina. Formed behind the retina. Right now, this is the condition of the eyes where the image of a nearby object is formed behind the retina, that is hypermetropia. Then cataract, what is cataract? Clouding of the eyes natural lens, that is cataract. Clouding of the eyes natural lens, that is cataract, right? Natural lens, right? That is cataract. So question number 350 जे आमे पाठ पढ़ी थिले आज आमे देखिबा 351, right? सो फटाफट वीडियो को लाइक कर दो एवं शेयर मध्य कर दो एवं जो मैंने फर्स्ट टाइम देखो बेटा चैनल को सब्सक्राइब कर दिया, राइट ना. नेक्स्ट क्वेश्चन नंबर 351. व्हाट इज द फिजियोलॉजिकल रेस्पॉन्स ऑफ द ईयर टू द इंटेंसिटी ऑफ साउंड? What is the physiological response of the ear to the intensity of sound? बेटा और साउंड आउछि ना सुबह जाउछि ना तम मान को सुबह जाउछि ना नहीं? Is it audible to all? सुबुछि ना? गुड इवनिंग सोनालिका, गुड इवनिंग. सुबुछि ना नहीं? What is the physiological response of the ear to the intensity of sound? Option A inertia, option B transmission, option C energy, option D loudness. So which option is the correct answer? So loudness is the correct answer. Beta option D is the correct answer. So this is the physiological response of the ear to the intensity of sound, right? Option D is the correct answer. Next question number 352 रची करना. Which function is transmission of sound vibration to the internal ear? Which function is transmission of sound vibration to the internal ear? Option रची auricle, option रची tympanic membrane, option C रची vestibule, option D रची eustachian tube. So which option is the correct answer? फटाफट आंसर कर दलो. Correct answer is tympanic membrane. Very good Sonalika. Tympanic membrane is the correct answer. Tympanic membrane's transmission of sound to the internal ear. Sound to the internal ear, right? The tympanic membrane transmission of sound vibration to the internal ear. So correct answer is option B. Very good. Next question number 353 रची. The size of which part of the eye contributes to the controlling the amount of light entering the eye? Option A lens, option B optic disc, option C macula lutea, option D pupil. So which option is the correct answer? फटाफट आंसर कर दियो. So correct answer is pupil, right ना? Pupil is the correct answer. Right. Next question number 354 achi. Out of the following, the bony labyrinth of inner ear consists of option A auditory ossicles, option B auditory canal, option C cochlea, option D pinna. So which option is the correct answer? फटाफट आंसर कर दियो. फटाफट आंसर कर दियो. Out of the following, the bony labyrinth of inner ear consists of option A auditory ossicles, option B auditory canal, option C cochlea, option D pinna. So which option is the correct answer? So bony labyrinth of inner ear consists of कौन बेटा? cochlea and what? vestibule and semicircular canal. Semicircular canal, right? So the bone labyrinth of the inner ear consists of the cochlea, vestibule and semicircular canal. So which option is the correct answer? Ab answer karo. So correct answer is Option C, right? So the following, out of the following, the bone labyrinth of inner ear consists of cochlea. Option C is the correct answer, right? Now option C is the correct answer. Next question, question number 355 rachi. The human skeleton is divided into which two main parts? Option which is skull and spine. Option which is bones and cartilage. Option which is axial and appendicular. Option which is upper and lower limbs. So which option is the correct answer? Beta हमें skeleton system रे पे questions देखिए. The skeleton system, the skeleton system रो क्वेश्चन देखिए. different system रो हमें questions देखुचे. एबे हमें skeleton system रो क्वेश्चन देखिए. फटाफट आंसर कर दियो. फटाफट आंसर कर दिया, राइट. क्वेश्चन नंबर 355 रा करेक्ट आंसर कौन बेटा? करेक्ट आंसर इज एक्सियल एंड एपेंडिकुलर हबो करेक्ट आंसर. एक्सियल एंड एपेंडिकुलर. सो एक्सियल स्केलेटन बेटा केतेटा बोन रोचे एक्सियल स्केलेटन रे? एक्सियल स्केलेटन रे, एक्सियल स्केलेटन रे केतेटा बोन रोचे? 80 bones, right? ना एक्सियल स्केलेटन रे 80 bones and appendicular skeleton केतेटा bone consist रोचे? केतेटा रोचे? appendicular skeleton consist of how many bone? 126 bones beta. 126 bone, right? So two main division of human skeleton are the axial skeleton and appendicular skeleton, right? ना हाँ कि नहीं? So option C is the correct answer beta. Next question, question number 356. Which bone is the main connector between the leg and foot, enabling dorsiflexion and plantar flexion of the foot? So option A is talus, option B is hamate, option C is capitate, option D is scaphoid. Option is talus, option B is hamate, option C is capitate, option D is scaphoid. So which option is the correct answer beta? Which option is the correct answer? So correct answer is talus. Option A is the correct answer. The talus bone is the primary connector between the leg and the foot, and it enabling dorsiflexion and plantar flexion of the foot. So correct answer is talus. Option A is the correct answer beta. Next question, question number 357. Which of the following types of joints allows for rotation around a single axis, like the joint between the first two vertebrae in the neck? Which of the following types of joint allows for rotation around a single axis, like the joint between the first two vertebrae in the neck? Option A condyloid joint, option B is saddle joint, option C is pivot joint, option D is hinge joint. So which option is the correct answer? फटाफट आंसर कर दिया. So correct answer is option C. Very good, small bites. Option C is the correct answer. Sonalika, option C. Very good. Option C is the correct answer. So the joint between first two vertebrae in the neck is a pivot joint. Option C is the correct answer. Next question. Largest carpal bone is. Largest carpal bone is. Option is scaphoid. Option is lunate. Option C is capitate. Option D is fusiform. Which option is the correct answer? Largest carpal bone is capitate bone. Capitate bone. Option C is the correct answer. Next question. Question number 359. The elbow is an example of a dash joint. The elbow is an example of a dash joint. Option is hinge. Option is pivot. Option C is condyloid. Option is planar. So which option is the correct answer? Planar. Which option is the correct answer? The elbow is an example of dash joint. Important MCQ बेटा माने रखे तो है ना. 5 questions. Option is hinge, option is pivot, option is condyloid, option is planar. So which option is the correct answer? Very good. So option A is the correct answer. Option A is the correct answer. The elbow is an example of hinge joint. Hinge joint. Right now, option A is the correct answer, beta. Next question, question number 360. 360. इतके जाने दबा hinge joints को कोठे रोचे बेटा hinge joints को कोठे रोचे ठीक है देखी दबा तापर हमें पढ़ेबा next questions hinge joints को कोठे देखिबा को मिले elbow रे माने फर्स्ट हमें देखिले elbow joints रे नहीं elbow और humerus then आउ कोठे देखिबा पड़छे knee रे आना नहीं and आउ कोठे देखिबा को मिले inner phalangeal joint right inner phalangeal joint आउ कोटी ankle joint रे भी देखिबा को मिले ए तीन चारटा जगह रे हमको hinge joint देखिबा को मिलु छी है ना hinge joint example कौन elbow joint knee joint inner phalangeal joint ankle joint right these all are the hinge joints beta right next question number 360 कौन अछि which of the following joints is also known as the gingivimus joint which of the following joints is also known as gingivimus joint which option is the correct answer option is ball and socket joint option B is hinge joint option C is pivot joint option D is saddle joint so which option is the correct answer so correct answer is option B hinge joint is also known as gingivimus joint hinge joint is also known as gingivimus joint right next question number 361 the elbow is a dash to the wrist option is distal option is lateral option is ventral option is proximal so which option is the correct answer so correct answer is option D proximal to the wrist elbow is the proximal to the wrist right elbow is the proximal to the wrist next question number 362 among the following the bone that belongs to the axial skeleton is option is hyoid option is tarsals option is humerus option is patella so correct answer कौन होगा बेटा correct answer is hyoid is the correct answer hyoid bone is the correct answer beta hyoid bone among the following the bone that belongs to the axial skeleton is hyoid bone right next question number 363 Cooper's ligament which is used frequently in bladder suspension procedure is also known as option is lacunar ligament option is pectineal ligament option is inguinal ligament option D is sacrospinous ligaments फटाफट आंसर कर दिला बेटा Cooper's ligaments which is used frequently in bladder suspension procedure is also known as option is lacunar ligaments option is pectineal ligaments option C is inguinal ligament option D is sacrospinous ligaments so which option is the correct answer फटाफट के आंसर कर दिया So correct answer is option C. Very good. Inguinal ligament, right? Now the pectineal ligament or pectineal ligament is also known as the inguinal ligaments, right? So correct answer कौन बेटा inguinal ligament. Option C is the correct answer, right? ठीक. Next question. Question number 364 is dash cartilage is most abundant blue white in color and able to bear weight. Dash cartilage is most abundant blue white in color and able to bear weight. Which cartilage is able to bear weight? Option is hyaline, option B is fibro, option C is elastic, option D is osseous. So which option is the correct answer बेटा फटाफट आंसर कर दिला फटाफट आंसर कर दिया फटाफट आंसर करो फटाफट सो करेक्ट आंसर इज हाइलिन कार्टिलेज Hyaline cartilage is the abundant type of cartilage found in the body, right? And is it able to bear weight? Beta, hyaline cartilage is the correct answer. Next question, question number 365. The proximal connection of metatarsal bones and tarsal bones make up the tarso-metatarsal joint complex, commonly referred to as option A Lisfranc joint, option B रचे Popart's joints, option C रचे compound joint, option D रचे phalanx joint. So which option is the correct answer? So correct answer is beta option A is the correct answer, Lisfranc joint, right? The proximal connection of metatarsal and tarsal bones. So proximal connection of metatarsal and tarsal bones make up the tarso-metatarsal joint complex, commonly referred as Lisfranc joint, right? Lisfranc joint. So option A is the correct answer. Next question, question number 366 is what provides the framework of synthesis of the cancellous bones tissue within metaphysis? Option A is diaphysis plate, option B is epiphysis plate, option C is epiphyseal plate, option D is metaphysical. So which option is the correct answer? Which option is the correct answer? So correct answer, sorry, epiphyseal plate. Option C is the correct answer. Epiphyseal plate, correct answer. Right, option C is the correct answer. Epiphyseal plate is also known as growth plate. Epiphyseal plate is also known as growth plate. Growth plate, right? And this is responsible for synthesis of the cancellous bone tissue within the metaphysis. This is epiphyseal plate or growth plate is responsible for what? Responsible for synthesis of the cancellous bone tissue within the metaphysis, right? Next question, question number 367. Which bone is known as collar bone? Which bone is known as collar bone? फटाफट आंसर कर दे, बिना गलती करे के, बिना wrongly, without any wrong, फटाफट आंसर कर दिया, फटाफट आंसर कर लो बेटा, फटाफट जो मैंने देखो ना प्लीज फटाफट आंसर कर दे. ऑप्शन नीचे स्टेरनम, ऑप्शन नीचे डायफ्राम, ऑप्शन सी नीचे क्लाविकल, ऑप्शन डी नीचे फीमर. सो व्हिच ऑप्शन इज द करेक्ट आंसर? व्हिच ऑप्शन इज द करेक्ट आंसर? करेक्ट आंसर इज ऑप्शन सी, क्लाविकल. वेरी गुड. क्लाविकल is known as collarbone. Sonalika, Can Angel, right? Option C is Lalita Mahanand. Option C, very good. Next question, question number 368. Which bone is known as breast bone? Option A is humerus, option B is sternum, option C is ribs, option D is femur. So which bone is the correct answer, beta? Which bone is breast bone? Correct answer is sternum, right? Sternum is known as the breast bone, right? Next question, question number 369. Which is a longest bone in human body? Which is a longest bone in human body? फटाफट आंसर कर दिया. ऑप्शन ए फीमर, ऑप्शन बी रही ह्यूमेरस, ऑप्शन सी रही टिबिया एंड ऑप्शन डी रही फिबुला. सो व्हिच ऑप्शन इज द करेक्ट आंसर? Correct answer is option A, femur, right? Next question, question number 370. The spinal cord is made up of 7 cervical vertebra, right? 7 cervical vertebra, 5 lumbar vertebra, and 4 or 5 fused sacral vertebra, 4 or 5 coccygeal vertebra, and how many thoracic vertebra, beta? How many thoracic vertebra? How many thoracic vertebra? Correct answer is option C, beta. Thoracic vertebra consists of 12 vertebra, right? Thoracic vertebra consists of 12 vertebra, right? T1 to T12, T1 to T12, right? Next question, question number 371 is beta. The suture that separates the parietal bone from the tabular portion of the occipital bone is called option A lambdoidal suture, option B frontal suture, option C sagittal suture, option D coronal suture. Most important MCQ, right? Most important MCQ 5-star वाला question. The suture that separates the parietal bone from the tabular portion of the occipital bone is called. तो फटाफट आंसर कर दो जहाँ को आसुची बेटा. जो मैंने पर्यंत वीडियो को लाइक करना, वीडियो को लाइक कर दे एवं शेयर कर दिया निज सांगा मानक पाखु जमती पहुंची पारिबा, राइट ना. तो फटाफट वीडियो को लाइक कर दो एवं शेयर कर दे एवं जो मैंने फर्स्ट टाइम चैनल को देखो प्लीज 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 सब्सक्राइब द चैनल. इट्स माय हम्बल रिक्वेस्ट टू वन एंड ऑल. फटाफट आंसर कर दिया. क्वेश्चन नंबर 371 correct answer is lambdoidal suture. Lambdoidal suture is a fibrous joint in the skull, right, that connects the occipital bone to the parietal bone, occipital bone to the occipital bone to the parietal bone, parietal bone, right. Is the connection between occipital bone to the parietal bone, right? Connection between occipital bone to the parietal bone, right? Next question. Question 372 is movement of the joints away from the midline of the body is called option A adduction, option B adhesion, option C adduction, then option D abduction. So which option is the correct answer beta? Which option is the correct answer? So correct answer is abductions, right? Abductions is the correct answer. Joints, movements of the joints away from the midline of the body is called abductions. Abductions, right? Next question, question number 373. Which of the following is an example of synarthrosis joints? Synarthrosis joints. Option A fibrous joints of the skull sutures. Option B wrist joints. Option C hip joint. Option D elbow joints. Which of the following is an example of synarthrosis joints? Synarthrosis joint. Which option is the correct answer? Correct answer is option A beta fibrous joints of the skull sutures. Fibrous joints of the skull suture, right? So synarthrosis joints are a type of joint that allows for no movement between the bone. No movement between the bones, right? That is synarthrosis joint, right? This synarthrosis joint is a type of joint that no movement between the bones, right? Option A is the correct answer. Next question, question number 374 is the expanded ends of a long bone are called option A tubercle, option B epicondyle, option C diaphysis, option D epiphysis. Which option is the correct answer beta? So correct answer is epiphysis. Correct answer is epiphysis. The expanded ends of long bone are called epiphysis, right? Long bone are called epiphysis. Next question, question number 375. Which of the following is an example of ball and socket joints? Most important MCQ. These are questions. Whatever beta. Skeleton system ro questions. हमें skeleton system देखुचे, right? So most important MCQ सब देखुचे. जो माना ये पर्यंत वीडियो को लाइक करना प्लीज 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 लाइक द वीडियो एंड शेयर द वीडियो. मात्र 10 जन लाइक करछन्ती. 15 जन देखुछ बेटा 15 लाइक्स एटलीस्ट हवा कथा, राइट? तो प्लीज लाइक द वीडियो एंड शेयर द वीडियो टू योर फ्रेंड्स. एंड यदि फर्स्ट टाइम देखुछ ताले चैनल को सब्सक्राइब कर दे बेटा प्लीज प्लीज प्लीज. इट्स my humble request to one and all. So which of the following is an example of ball and socket joints? Option A skull joint, option B thumb joint, option C hip joint, option D elbow joints. So which option is the correct answer? फटाफट आंसर कर दो, फटाफट आंसर करो. तो correct answer is which joint? Very good. So hip joint is the correct answer. Hip joint is the correct answer. बेटा मुझे भल लगुनि फिर भी मुझे तुम क्लास करने बुझ ना। इस खुशी में तो एक लाइक बनता है, वीडियो को लाइक कर दो, शेयर भी कर दो, ठीक। नेक्स्ट क्वेश्चन नंबर 376, कार्पो मेटाकार्पल जॉइंट्स इज एन एग्जांपल ऑफ व्हिच ऑफ द फॉलोइंग टाइप्स ऑफ जॉइंट्स। ऑप्शन ए रचे हिंज, ऑप्शन बी रचे बॉल एंड सॉकेट, ऑप्शन सी रचे पाइवट एंड ऑप्शन डी रचे सैडल। सो व्हिच ऑप्शन इज द करेक्ट आंसर? फटाफट आंसर करो, फटाफट। The correct answer is saddle joint, right? This is an example of carpometacarpal joint, and this is specifically of the thumb, right? Specifically seen in thumb. Next question number समझते जॉब पाइबे, समझते यू ऑल्सो बेस्ट ऑफ लक, समझते जॉब पाइब, टेंशन नबार नहीं। हमको पाठ पढ़ार अच्छी, जो मैंने भी लाइव क्लासेस देखुच ना कि समस्त नर्सिंग गुड़ाए पोस्ट अच्छी, आमको गोटे गोटे खाली पोस्ट दरकार, हाँ ना ना, गोटे गोटे सीट दरकार, गोटे गोटे पोस्ट दरकार, समस्त जॉब हबार अच्छी। जी जन भी देखुच ना बेटा समस्त हम जॉब, से हमको पढ़ा पड़ो, बुझीपार ना। तो बोले पॉजिटिव थिंकिंग करिवार अछि बेटा, पॉजिटिव थॉट रे रहिवार अछि, राइट। Tarsal of the ankles are example of which type of bone? Option is short bones, option B is sesamoid bones, option C is long bones, option D is pneumatic bones. So which option is the correct answer? Correct answer is option A beta, short bones, right? Option A is the short bones. Very good. Short bones. Tarsal of the ankles are example of which type of bone? Short bones is the correct answer. Next question number 378. How many bones are there in the lower extremity in a normal adult? Option is 58, option B is 62, option C is 64, option D is 60. So which option is the correct answer? How many bones are there in the lower extremities in a normal adults? फटाफट आंसर कर लो। So each lower limbs beta, each lower limb or leg has 30 bones, has 30 bones, हाँ ना नहीं। तो लोअर एक्सट्रीमिटीज, बोथ लोअर एक्सट्रीमिटीज हो गले बेटा केते हे जो, बोथ लोअर एक्सट्रीमिटीज केते हे जो 2 into 30 केते हे गला 60 बोन हे गला, हाँ ना नहीं। कौन कौन बोन रोचे बेटा लोअर एक्सट्रीमिटीज रे? फीमर 1, राइट ना। देन पैटेला अच्छी कितना गोटे, हाँ ना नहीं। देन टर्सल कितना बेटा 7टा। फैलेंजेस कितना, फैलेंजेस अच्छी कितना बेटा 14टा, राइट ना। देन आउ कितना अच्छी टिबिया कितना गोटे। फिबुला कितना, फिबुला 1 and metatarsal 5 and metatarsal कितना 5. So एमती मिसे कि कितना रोचे 30, हाँ ना ना। each lower limb रोचे 30, हाँ ना नहीं। 30 into 2 is 60. So how many bones are there in the lower extremities in a normal adult? So correct answer is option D. Very good. Option D is the correct answer. Next question number 379. What is the angle of Lewis? Option A is the landmark of sternum. Option B is the angle between clavicle and sternum. Option C is the junction between sternum and manubrium. Option D is the superior border of second rib. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दिया। Which option is the correct answer? So correct answer is option C, beta. The junction between sternum and manubrium, right? The junction between sternum and manubrium, right? Next question, question number 380. A body fluid found in joints is called option which is most important MCQ. Body fluid found in joints is called option which is peritoneal fluid, option B is synovial fluid, option C is cerebrospinal fluid, option D is amniotic fluid. So which option is the correct answer, beta? Which option is the correct answer? फटाफट आंसर कर दे जो मैंने कहा उसकी फटाफट आंसर कर ही दिया. So correct answer is synovial fluid, right? Synovial fluid most easy answer, right? Now next question, question number 381. An immovable joint is called, it will be important MCQ beta. Immovable joint is called, an immovable joint is called option which is synarthrosis, option which is amphiarthrosis, option C is polyarthritis, option D is diarthrosis. So which option is the correct answer beta? So correct answer is synarthrosis. Correct answer is option A. हमें पूर्व पढ़ी थी डिस्कशन करते लिया विषय अन्य no movement or very limited movement, synarthrosis, right now. So correct answer is option A. Next question, question number 382. The largest synovial joint in the body is most important MCQ beta. Thus 5 star, right? The largest synovial joint in the body is option A is the knee joint, option B is the shoulder joint, option C is the ankle joint, option D is the wrist joint. So which option is the correct answer? So correct answer is the knee joint is the largest synovial joint. Knee joint is the largest synovial joint, right now. Next question, question number 383. An example of sesamoid bone is an example of sesamoid bone is option is patella, option is ribs, option C is carpals, option is sternum. Most important MCQ eta beta. Ella most important MCQ. An example for sesamoid bone is option is patella, option is ribs, option C is carpals, option is sternum. So which option is the correct answer? So correct answer is option A. Patella is an example for sesamoid bone, right? Sesamoid bone. Patella is also known as sesamoid bone, right? Next question, question number 384. Normal bone cell is known as option A is osteocyte, option B is osteoblast, option C is osteoclast, option D is monocyte. So which option is the correct answer? फटाफट कर दिया आंसर, फटाफट कर दिया आंसर. Normal bone cell is known as osteocyte, osteoblast of osteoclast, option D is monocytes. So which option is the correct answer? So normal bone cell is known as osteocyte. Option A is the correct answer. Osteocyte. Osteocyte, right? Normal bone cell is known as osteocyte. Very good. Very good, very good. Next question, question number 385 is the part of the bone that enters into the formation of a joint is called. The part of the bone that enters into the formation of a joint is called. Option A is articulating surface, option B is bony sinus, option D is condyle, option D is facts. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दिया. The part of the bone that enters into the formation of a joint is called. Which option is the correct answer? फटाफट आंसर कर दिया. Articulating surface, bony sinus, option D is condyle, option D is facts. So which option is the correct answer? So correct answer is option A, articulating surface. Articulating surface is the correct answer, right? Next question, question number 386. It is the premature closure of the sagittal suture is called. The premature closure of the sagittal suture is called. Option is scaphocephaly, option B is oxycephaly, option C is acrocephaly. Acrocephaly, right? Acrocephaly, option D is encephaly, right? Scaphocephaly, oxycephaly, acrocephaly. C beta, double E is C. acrocephaly, option D anencephaly. So which option is the correct answer? Which option is the correct answer? So correct answer is scaphocephaly. So option A is the correct answer. Scaphocephaly is the premature closure of the sagittal suture is scaphocephaly, right now. Next question number 387 is the average submentovertical diameter is diameter is option is 9.5 centimeter, option B is 10 centimeter, option C is 11.5 centimeter, option D is 13.5 centimeter. So which option is the correct answer? So correct answer is option C, 11.5 centimeter. 11.5 centimeter is the average submentovertical diameter. 11.5 centimeter. Next question number 388 achi. Strong weight bearing synovial joints with irregular elevation and depressions that produce interlocking of the bone is called option en bloc dissection, option B photoablations, option C debulking, option none. So which option is the correct answer beta? So correct answer is none haba, right? Kichi haba nahi beta. So a strong weight bearing synovial joint with irregular elevation and depression that produce interlocking of the bone is called what beta? Sacroiliac joint haba katha beta, right? Sacroiliac joint haba is called sacroiliac joint haba, right? Na sacroiliac joint haba, right? But itire kichi deyni, so none haba. Option D is the correct answer, right? Sonalika none. Next question number 389 is which of these is not an axial skeleton bone? Option A is cranium, option B is ethmoid, option C is sacrum, option D is humerus. So which option is the correct answer? Which option is the correct answer? Beta फटाफट answer करो. Which option is the correct answer? The correct answer is humerus, right? Humerus is not an axial skeleton bone, right now. This is an appendicular skeleton. No, this is an appendicular skeleton. So axial skeleton consists of 80 bone. Right? This is consist of 80 bones. Axial skeleton consists of 80 bones. Including skull, vertebra and rib cage. Including skull, vertebra and rib cage. Right? Next question number 390. Which of the following bone is not a sesamoid bone? Option is stapes, option B is patella, option C is fibula, option D is first metacarpal. So which option is the correct answer beta? फटाफट आंसर करो. The correct answer is option C, fibula, right? Fibula is the correct answer. So this is not a sesamoid bone, right? Fibula is not a sesamoid bone, right? Next question number 391. Which of the below is not a function of the fibrous skeleton of the heart? Option A conduct the impulses from artery to ventricles, option B forms a structural foundation for the heart valves, option C prevents overstretching of the valves, option D act as a print or insertion for cardiac muscles fiber. So which option is the correct answer? So correct answer is beta option A, right? Option A is the correct answer. So conducts the impulses from atria to ventricles. This is not a function of fibrous skeleton of the heart, right? So option A is the correct answer. Next question number 392. Which of the following is not a long bone? Answer करो फटाफट आंसर करो. which of the following is not a long bone? Option is humerus, option which is sternum, option C is patella, option which is ulnar. Which of the following is not a long bone? फटाफट आंसर कर देला. Very good, very good, very good. बहुत बढ़िया. So correct answer is option C, patella. Right? Patella is not a long bone. Patella is not a long bone. है ना? Patella is not a long bone. Patella is a sesamoid bone. Patella or kneecap. है ना? It's a sesamoid bone. देखो आप कौन कहते हैं kneecap. Kneecap or patella is a sesamoid bone, not a long bone, right? And this is small independent bone beta. Next question. Question number 393 रही. हमें अभी देखिए मस्कुलर सिस्टम रे किछि क्वेश्चंस. मस्कुलर सिस्टम, द मस्कुलर सिस्टम, राइट? द मस्कुलर सिस्टम रे किछि क्वेश्चंस देखिबा. Which of the muscles dysfunctions results in urinary retention? Option is levator ani, option is diaretos, option C is detrusor muscles, option D is cremaster muscles. So which option is the correct answer? Dysfunctions results in urinary distension. It's a urinary retentions. Which of the muscles dysfunction results in urinary retention? So which option is the correct answer? Option C. Very good. Option C is the correct answer. Detrusor muscles. Detrusor muscles can cause urinary retention. It causes urinary retention. Urinary retention. Urinary retention. आना नहीं urinary retention की करूची को मसल जो होचे जो को detrusor muscle जदि dysfunction हे गेला ताहले कान हबा urinary retention हबा, right ना. Next question. Question number 394 अछि बेटा. Which of the following is not a muscular tissue? Which of the following is not a muscular tissue? Option is skeletal muscles, option B is cardiac muscles, option C is smooth muscle, option D is muscles fiber. So which option is the correct answer? फटाफट आंसर कर दिया. Correct answer is muscles fiber, right? So skeletal muscles, cardiac muscle and smooth muscles are the type of muscular tissue. These all are the muscular tissue. है ना नहीं? Muscles fiber known as muscle cells. है ना नहीं? This is the muscle cell. And these all are the muscular tissue, skeletal muscles, cardiac muscles, smooth muscle, these all are the types of muscular tissue, but muscles fiber is a muscle cell. Option D is the correct answer. Next question, question number 395. Which cell mediator of inflammation stimulates smooth muscles contractions? Which cells mediator of inflammation stimulates smooth muscles contractions? Option is serotonin, option B is prostaglandins, option C is leukotrienes, option D is histamine. So which option is the correct answer? बेटा फटाफट आंसर कर दिया. बेटा जो मैंने लाइव देखो फटाफट वीडियो को लाइक कर दिया, शेयर कर दिया एवं यदि फर्स्ट टाइम चैनल को देखो ना प्लीज 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 सब्सक्राइब द चैनल. इट्स माय हम्बल रिक्वेस्ट टू वन एंड ऑल बेटा, प्लीज subscribe the channel. So question number 395 रो correct answer कौन हबा? Very good, very good, very good. Jayanti Tandi. Option A is the correct answer. Serotonin is the correct answer. Serotonin is the correct answer. Right? Option A is the correct answer. Next question. Muscle tone of lower esophageal sphincter LES is maintained by option A acetylcholine, option B nitric oxide, option C vasoactive intestinal polypeptide, option D pancreatic enzyme. So which option is the correct answer? फटाफट आंसर कर दिया. Which option is the correct answer? Which option is the correct answer? Which option is the correct answer? muscle tone of lower esophageal sphincter, that is LES, is maintained by option A acetylcholine, option B nitric oxide, option C vasoactive intestinal polypeptide, option D pancreatic enzyme. So which option is the correct answer? The correct answer is option A, acetylcholine. Option A is the correct answer. Next question number 397. Which one of the following muscles is called the peripheral heart? Which one of the following muscles is called the peripheral heart? 5-star questions, 5-star questions, 5-star question. Option is plantaris, option is gastrocnemius, option is soleus, option is sartorius. So which option is the correct answer? Correct answer is option C, right? Soleus is the correct answer. This is the peripheral heart. The peripheral heart is the soleus muscles are located in the calf and it plays a crucial role in pumping venous blood back to the heart from the lower extremities, and it acting as a peripheral what? Heart. Right, soleus, and this is located at calf, CALF, calf. Next question number 398. The boundaries of auscultatory triangle are option A medial boundary of scapula, latissimus dorsi and trapezius, medial boundary of scapula, latissimus dorsi and trapezius. Option B is teres majors, latissimus dorsi and medial boundary of scapula. Option C is lateral boundary of scapula, latissimus dorsi and trapezius. Option D is teres minors, latissimus dorsi and medial boundary of scapula. So the boundaries of auscultatory triangles are, which option is the correct answer? So correct answer is option A, beta. Medial boundary of scapula, latissimus dorsi and trapezius is the correct answer. So auscultatory triangle is also known as triangle auscultation, beta. Triangle auscultation, right? Triangle auscultations. How कौन क्वेश्चन दिया को? Triangle auscultation. Triangle auscultation. तो triangle auscultation भी कहा होचे, right? हम next question देखिबा. Question number 399 रे अछि. This refers to an increase in muscle size and shape due to an increase in muscles fiber. Option is hypertonicity, option B is hypertrophy, option C is hyperfibrosis, option D is muscular edema. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is option B, hypertrophy. Hypertrophy is the increase in the size of cells, and which is leading to the enlargement of the corresponding tissue, corresponding tissue or organ such as muscles fiber, right now, such as muscles fiber. So hypertrophy is the correct answer. Next question number 400. Which muscles turn the palm upward or anteriorly? Which muscles turn the palm upward or anteriorly? Option is pronator teres, option is external end sphincter, option C is obturator externus, option D is supinator. So which option is the correct answer? So correct answer is option D, right? Option D is the correct answer. Supination or supinator, right? Option D is the correct answer, beta. Next question number 401. Which of the following quadriceps femoris muscles help in flexion of the thigh? ऑप्शन रचे रेक्टस फीमोरिस, ऑप्शन रचे वेस्टस मेडियलिस, ऑप्शन सी रचे वेस्टस इंटरमीडियस, ऑप्शन डी रचे वेस्टस लेटरालिस. So which option is the correct answer? So correct answer is option A, rectus femoris. Rectus femoris. Quadriceps femoris and quadriceps femoris grooves consist of 4 muscles beta. Consist of 4 muscles. Quadriceps femoris consist of 4 muscles. Consist of 4 muscles, right? 4 muscles. कौन सेटा बेटा? First is rectus femoris. Rectus femoris. Second one is vastus medialis. Vastus medialis, right? How कौन? Vastus intermedius. Vastus intermedius and vastus lateralis right? So rectus femoris कौन करछे? Helps in rectus femoris helps in flexion of the thigh, right? Rectus femoris helps in flexion of the thigh, right? Option A is the correct answer, right? Now these all are the quadriceps femoris muscles. Next question, question number 402 rachi beta. What is the name of the muscles that extend from this sphenoid bone to the mandible? What is the name of the muscle that extend from the sphenoid bone to the mandible? Option है pterygoid, option B है masseter, option C है sternocleidomastoid, option D है trapezius. So which option is the correct answer beta? Which option is the correct answer? So correct answer is option A, right? Sorry. Pterygoid is the correct answer beta. So option A is the correct answer. Sorry. Next question, question number 403 rachi. The muscles that cover the shoulder and back of a neck are option rachi biceps, option B rachi trapezius, option C rachi temporalis, option rachi masseter. So which option is the correct answer? फटाफट आंसर कर दिला. So correct answer is trapezius, right? Correct answer is trapezius. The muscle that cover the shoulder and back of the neck are trapezius. Next question, question number 404 achi. Tropomyosin in the muscle fiber is a dash protein. Tropomyosin in the muscle fiber is a dash protein. Option is contractile, option is anchoring, option C is structural, option is regulatory. So which option is the correct answer beta? Most important MCQ. Most important MCQ. Tropomyosin in the muscle fiber is a dash protein. The correct answer is regulatory protein. Which of the below is the true statement about the H zone of the sarcomere? H zone of the sarcomeres, right? Option is it is divided of thick or thin filaments. Option is it contains thick and thin filaments lying side by side. Option C is it contains thin filaments only. Option D it contains thick filaments only. So which option is the correct answer beta? फटाफट आंसर कर दो. So correct answer is option D, it contains thick filaments only, right? Next question, question number 406 is the long lead of bicep brachial muscles arises from which of the following? The long lead of biceps brachial muscles arises from which of the following? Option A intraglenoid tubercle of scapula. Answer A infraglenoid tubercle of scapula. Option B supraglenoid tubercle of scapula. Option C coracoid process of scapula. Option D lateral epicondyle of humerus. So फटाफट आंसर कर लो बेटा. इतने डिफिकल्ट ना गुड़ा करना है कि तो Which option is the correct answer? So correct answer is supraglenoid tubercle of scapula is the correct answer. Supraglenoid tubercle of scapula, the long head of the biceps brachii muscles originates from the supraglenoid tubercles of the scapula beta. So which option is the correct answer? Option B is the correct answer beta. Question number 406 the correct answer is option B, right? Next question. Question number 407 अछि the muscles that lies on the anterior thoracic wall is option अछि pectoralis major, option B is deltoid, option C is triceps, option D is biceps. So which option is the correct answer? So correct answer is pectoralis major, right? Correct answer is pectoralis majors. The muscle that lies on the anterior thoracic wall is pectoralis major. Next question, question number 408 dash is the major muscles responsible for breathing in humans. Option A is trapezius, option B is diaphragm, option C is rectus abdominis, option D is sternocleidomastoid, sternocleidomastoid. Right, the dash is the major muscles responsible for breathing in humans. Option A is trapezius, option B is diaphragm, option C is rectus abdominis, option D is sternocleidomastoid. So which option is the correct answer? Which option is the correct answer? Beta फटाफट आंसर कर दिया. Correct answer is option B, diaphragm, right? Diaphragm, very good. Lipun Mahakod. Option B is the correct answer. Sonalika, option B, very good. जो मैंने first time channel को देखो, please subscribe the channel बेटा. It's my request to one and all. जो मैंने first time देखो, please subscribe the channel and share the video and like the video. Next question, question number 409 है Wachs's muscle each and yes, option D is brachioradialis, option B is serratus anterior, option C is biceps brachii, option D is deltoid. So which option is the correct answer? So serratus anteriors or serratus muscles is called Wachs's muscles. Serratus muscles is known as Wachs's muscles. Wachs's muscles. Serratus muscles is known as Wachs's muscles. Right. And this is play a key role in the movement of the scapula. Okay, it play a crucial role in the movement of the scapula, right? Serratus muscles. So correct answer कौन बेटा? Correct answer is option B. Next question, question number 410 रची 410 रची बेटा. The loud growling sound produced by the overactive intestinal circulation is called option रची Burberry and option B is burping, option C is electricity, option D is rearrangement. So which option is the correct answer? So correct answer is Burberry beta. Option A is the correct answer. Right now, Burberry is commonly known as beta stomach growling. Stomach growling कौन थे बेटा? Stomach growling. Right, and this is the sound produced by the muscles contraction and gas movement in the digestive system as food travels through the intestine. Right now. So option A is the correct answer. Next question, question number 411. A type of correct order wala questions are most of all time, right? So most important MCQ. So what are the basic process of the digestive system in the correct order? So फटाफट answer करो. What are the basic process of the digestive system in the correct order? Option A absorption, ingestions, digestion, mixing and propulsions, then defecations, then secretions. Option B is ingestions, absorptions, defecations, digestion, secretion, mixing and propulsions. Option C is digestion, ingestion, secretion, absorption, defecation, then mixing and propulsion. Option D is ingestion, secretion, mixing and propulsion, then digestion, absorption and defecation. So which option is the correct answer? फटाफट आंसर कर दिया. Very good, one and all. Sonalika Lipunmark, Jashkatan Chinda, Lalita Manan, Madhushmita Jena, Can Angel, Kaveri Malik. Option D only correct answer. Beta, option D is the correct answer. Ingestion, so different process, such a basic process of the digestive system. First, ingestion, then secretions, right? Then mixing and propulsions, then digestion, then absorption, then defecations, right? So last option is the correct answer. Most important MCQ, but am the correct sequence su pacharibo, correct order gudaka, right? So amku sub dekhibar achi, right? Next question number 412. Two types of contractions occur regularly in the small intestine are dash and dash. Option is tonic contractions, ultra propulsive contractions. Option B is joint migrating contraction, segmentation. Option C is segmentation contraction, intestinal peristalsis. Option D is intestinal peristalsis, tonic contraction. So which option is the correct answer? Which option is the correct answer? फटाफट आंसर कर दिला. Correct answer is segmentation contractions and intestinal peristalsis is the correct answer. This is the two main types of contraction that occur in small intestine. This occurs in this main two types of contraction occurs in small intestine. Two types of contraction it occurs in small intestine, that is segmentation contraction and intestinal peristalsis, right? Next question number 413. Which layer controls motility of the digestive tract? Which layer controls digestive system? रा क्वेश्चन देखो बेटा digestive system रा किछि most important MCQ देखो which layer controls motility of the digestive tract? Option है lamina propria layer. Option B है submucosa layer. Option C है muscles layer. Option D है serosa layer. Which option is the correct answer? फटाफट आंसर कर दिया. Which option is the correct answer? So correct answer is muscles layer, right? Muscles layer is the correct answer. This layer controls motility of the digestive tract. Muscles layer is control the motility of the digestive tract. So option C is the correct answer, right? Next question number 414. The innermost layer of the gastrointestinal tract is named as option is mucosa. Option B is muscularis externa. Option C is serosa. Option D is submucosa. So which option is the correct answer? फटाफट आंसर कर दो. So correct answer is बेटा option A, mucosa, right? So gastrointestinal tract or GI tract, बेटा GI tract is composed of four layer. GI tract is composed of four layer. हाँ ना नहीं, four layer. कौन बेटा सीटा? First is serosa और edematous नहीं, edematous, serosa और edematous. 2 नंबर कौन बेटा? muscularis और sclemtalar और तको कौन थी? SCHLEM sclemtalar. 3 नंबर कौन अच्छी बेटा? सबम्यूकोसा को कौन दे? sclematalar. याको मध्य स्केम टैलर भी कहते बेटा, या को भी स्क्लेम टैलर कहते, राइट। देन 4 नंबर अच्छी बेटा आउ गोटे कौन, म्यूकोसा, म्यूकोसा, this is also sclem talar coach, right? So these all are the 4 GI tracts 4 layer, right? Serosa, muscularis, submucosa and mucosa, right? These are the 4 layers of gastrointestinal tract, and this is the mucosa is the innermost layer of the GI tract. Innermost layer of the GI tract is mucosa, right? Next question, question number 415 achi beta. Which organ helps to prevent choking while eating and drinking? Which organ helps to prevent choking while eating and drinking? Option is tonsil, option is thyroid, option is epiglottis, option is pharynx. So फटाफट आंसर कर लो, फटाफट आंसर करो। मैं पानी पीला बेले कि खाइला बेले हमको हेल्प करे, हाँ ना नहीं, केमती हेल्प करे, ट्रैकिया को कवर करे कि हाँ ना नहीं, ट्रैकिया को कवर अप करला परे और वाइन 5 को कवर अप कर ले हमें आराम से खाऊचे कि पानी पीऊचे, हाँ ना नहीं, बुझी पारलो। So which option is the correct answer beta? So correct answer is epiglottis, right? Option C is the correct answer. Very good. Lipun Mahakud, Sonalika, Junu, Madhushmita Jena, Lalita Mahanand, Saira Rani Bagh, Ken Angel, Haskitan Chinda. Very good. Okay, next question, question number 416. is that the key enzyme of cholesterol synthesis is option is HMG or so the key enzyme of cholesterol synthesis is option is HMG coenzyme A reductase. Then option B is HMG coenzyme A dehydrogenase. Option C is HMG coenzyme A synthase. Option D is HMG coenzyme A lyase. Right? HMG कौन बेटा? Hydroxy 3 methyl glutaril, right? HMG रा full form है बेटा HMG hydroxy 3 right, hydroxy 3 methyl glutaril, right ना? So the key enzyme of cholesterol synthesis is, so which option is the correct answer? डिफरेंट स्टेप्स देखिए कि कोलेस्ट्रॉल सिंथेसिस हो जाए, राइट। सो which is the key enzyme of cholesterol synthesis, right ना। so चार्टा ऑप्शन देसी बेटा सिथुर हमको चूज करवार अछि, सो करेक्ट आंसर इज ऑप्शन ए, राइट। एचएमजी कोएंजाइम रिडक्टेज, कोएंजाइम ए रिडक्टेज, राइट। ऑप्शन ए इज द करेक्ट आंसर। नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 417 अछि स्पेसिफिक फंक्शंस ऑफ लिवर इज ऑप्शन अछि एक्सक्रीशंस, ऑप्शन अछि हिस्टोलाइसिस, ऑप्शन सी डाइजेशन, ऑप्शन डी ग्लाइकोजेनोलाइसिस। So which option is the correct answer? Correct answer is option D, glycogenolysis. So glycogenolysis is the process that breaks down stored glycogen into glucose, right? Glycogenolysis. What is the glycogenolysis? This is the process of breakdown stored glycogen into glucose. Breakdowns stored glycogen into glucose, right? This is the specific functions of liver, right? Option D is the correct answer. Very good, thank you beta, बहुत धन्यवाद। Question number 418, the inferior epigastric artery is the branch of, ऑप्शन है एक्सटर्नल इलियक आर्टरी, ऑप्शन बी रहे इंटरनल इलियक आर्टरी, ऑप्शन सी रहे obstructor iliac artery, option is celiac trunk. So which option is the correct answer? The inferior epigastric artery is the branch of, option A is external iliac artery, option B is internal iliac artery, option C is obturator iliac artery, option D is celiac trunk. So which option is the correct answer? So correct answer is option A, but external iliac artery, right? Next question, question number 419, the appendix is in, option is the left antecubital fossa, option B is the left iliac fossa, option C is the right antecubital fossa, option D is the right iliac fossa. So which option is the correct answer beta? So right iliac fossa is the correct answer, right now. So option D is the correct answer beta. The appendix is in right iliac fossa, right now. Appendix is in the right iliac fossa, right. Question number 420 rachi beta, mechanism of action of insulin occurs through, option A change in membrane permeability, option B activation of intracellular enzymes, option C activation of genes, option D via secondary messenger. Which option is the correct answer? Mechanism of action of insulin occurs through, option is change in membrane permeability, option is activation of intracellular enzymes, option C is activation of genes, option D is via secondary messenger. So option B is the correct answer, right now. Activation of intracellular enzymes is the correct answer. So activations of intracellular enzymes is the actions of insulin. This is the mechanism of action of insulin. Mechanism of action of insulin, right? Mechanism of action of insulin occurs through activation of intracellular enzymes. Option B is the correct answer. Next question, question number 421 is the part of the colon that absorbs the remaining water and other key nutrients from the indigestible material, solidifying it to form stool is, option A is ascending colon, option B is descending colon, option C is rectum, option D is transverse colon. So which option is the correct answer? Which option is the correct answer beta? So correct answer is ascending colon, right? Correct answer is ascending colon. The part of the colon that absorbs the remaining water and other key nutrients from the indigestible materials, solidifying it to form stool is ascending colon, right? This is the part of large intestine, beta. This is the part of large intestine. Large intestine is responsible for absorbing remaining waters and nutrients from indigestible materials, right? Solidifying into stool, right? So large intestine, ascending colon. And ascending colon is the part of large intestine, right now. So correct answer is option A, beta, right? Next question. Question number 422. The largest gland in the body is option A is the pancreas, option B is the liver, option C is the kidney, option D is the spleen. So which option is the correct answer, beta? समझता को जाना थे भाई questions का answer. So the largest gland in the human body, the largest gland in the body is which option is the correct answer? फटाफट के answer कर दे बेटा. Which option is the correct answer? Okay. So largest gland in the body is liver. Option B is the correct answer. Next question number 423. The exocrine pancreas is responsible to option A secrete products directly into the bloodstream. Option B is control blood glucose level. Option C is secrete digestive enzymes, ions, and water in gastrointestinal tract. Option D is to act as a part of immune systems. So which option is the correct answer? Which option is the correct answer, beta? So correct answer is option C. Endocrine pancreas is responsible to secrete digestive enzymes, ions, and water in gastrointestinal tract. So option C is the correct answer. Right. Next question number 424. Largest gland in the human body is option is thyroid, option which is liver, option C is pituitary, and option D is adrenal. So which option is the correct answer? So correct answer is liver. Next question number 425. Innermost layer of GI tract formed by option is epithelium tissue, option is connective tissue, option C is nervous tissue, option is cardiac tissue. So which option is the correct answer? Beta फटाफट answer कर देलो. Question number 425 is innermost layer of GI tract formed by option is epithelium tissue, option B is connective tissue, option C is nervous tissue, option D is cardiac tissue. Which option is the correct answer? So correct answer is epithelium tissue. Option A is the correct answer, right now. Option A is the correct answer. So innermost layer of GI tract formed by epithelium tissue. Epithelial tissue or epithelium tissue, right? Next question number 426. Intrinsic factor of Kestel is secreted by option is parietal cells, option B is mucous cells, option C is B cells, option D is chip cells. So which option is the correct answer, beta? Which option is the correct answer? Intrinsic factor of Kestel is secreted by option is parietal cells, option B is mucous cells, option C is B cells, option D is chip cells. So which option is the correct answer? So correct answer is option A, beta. Intrinsic factor of Kestel is secreted by parietal cells, and this is located in the stomach. And this is located in the stomach, right? And this is responsible for secreting hydrochloric acids and vitamin B12 absorptions, beta. Right now, vitamin B12 absorptions and hydrochloric acids secretions also. Next question number 427 beta. 427 motilin is secreted by cells in option is liver, option is pancreas, option is esophagus, option is duodenum. Most important MCQ. Motilin is secreted by cells in option is liver, option is pancreas, option C is esophagus, option D is duodenum. So which option is the correct answer? So फटाफट आंसर कर देलो. Motilin is secreted by cells in which option is the correct answer? So correct answer is duodenum, beta, right? Duodenum. Motilin is secreted by cell in duodenum, right? Next question number 428. Which of the following enzymes convert fats into fatty acid and glycerol? Option is bile, option is trypsinogen, option is salivary amylase, option is lipase. So which option is the correct answer? Beta फटाफट आंसर कर देला. So correct answer is option D, beta, lipase. Lipase is the enzyme responsible for digestion of fat, right? Now digestion of fat into their simple component fatty acid and glycerol, right? The correct answer कौन होगा? Lipase. Option D is the correct answer, beta. Next question. Question number 429. In which organ does the absorption or iron takes place? Option A is colon, option B is duodenum, option C is liver, option D is stomach. So which option is the correct answer? फटाफट आंसर कर देला. Correct answer is beta option B, right now. So iron absorption कोटी होची बेटा. Iron absorption कोटी होचे in duodenum, right? And this is the first part of small intestine, right? Now this is the first part of small intestine. First part of small intestine. Right? So iron absorption occurs in the duodenum, and this is the which is the first part of small intestine, right? Now next question number 430. Which of the following digestive enzymes present in gastric juice is primarily responsible for breaking down proteins? Option is trypsin, option is pepsin, option is peptidase, option is chymotrypsin. So which option is the correct answer? सर बहुत जल्दी आंसर कहउछंती बेटा. महा माराथन क्लास ना, हमको मैक्सिमम बेटा 30 डेज रे 10,000 क्वेश्चन देखिबार अछि. सेही पई बेटा जोटा बुझेबार कथा म तमन टिटी बुझे दोछि, बट क्वेश्चंस देखो अछि बेटा, राइट ना. तमे देखो बेटा, हमें 30 दिन 30 डेज हमर टारगेट अछि. हम वी मस्ट वॉच 10,000 MCQ. जो धीरे धीरे जदि चलेबा गाड़ीटा बेटा, हमें 10,000 क्वेश्चंस 10,000 MCQ इंपोर्टेंट MCQ कवर अप करि परिबानी हैला. फिर भी मु मझिरे स्लो करूछि ना बेटा. Which of the following digestive enzymes present in gastric juice is primarily responsible for breaking down proteins? Option is trypsin, right now. Then option B is pepsin, option C is peptidase, option D is chymotrypsin. So which option is the correct answer? बेटा फटाफट के आंसर कर दियो. So correct answer is option B, बेटा pepsin, right? Pepsin is the correct answer. बेटा हमको एग्जाम दबा पूर्व मैक्सिमम क्वेश्चंस कवर अप करके परीक्षा दबा पई गलेगा सब क्वेश्चंस आंसर करि पारिबा, हां ना नहीं? तो मत हमको सब सब्जेक्ट देखिबार अछि ना बेटा सब सब्जेक्ट को हमें पढ़िबार अछि ताले मो एनाटॉमी फिजियोलॉजी की माइक्रोबायोलॉजी की साइकियाट्रिक की एमएसएन पढ़े देबेनी ना बेटा सब सब्जेक्ट को कवर अप करबा विद इन 30 डेज ऑलरेडी ऑलरेडी आज केते ही गलानी 11th ही गलानी राइट ना 11th ही गलानी 11th जुलाई ही गलानी से पैना बेटा संडे दिन मु दुई दुई थर क्लास नोची संडे मॉर्निंग रे क्लास 10 AM एंड इवनिंग रे क्लास 4 PM मैक्सिमम टाइम कौन पाए बेटा तुम मान सहित समय बितौछि जेमति तुम मान मैक्सिमम क्वेश्चंस देखि पारिबो एंड मैक्सिमम क्वेश्चंस देखि गले बेटा कम से कम किछि तो आंसर आसीबो बेटा एटलीस्ट तो जॉब पाई जेति की मार्क्स दरकार जेति की परसेंटेज दरकार कि जेति की परसेंटाइल दरकार सेति की तो कम से कम करि पारिबो ना बुझी परला तो सो डोंट वरी बेटा को समय स्पीड अप करबार छै को समय स्लो करबार छै मु प्लान कर सारी से हिसाब रे मु नेबी तमे देखिबो सेटा बेटा राइट जदी बेसी स्पीड ही जाउ छै बेटा आराम से देखि देखि कि हमें को जगह रे स्लोली नेबा को जगह रे स्पीड नेबा सेटा मु प्लान करे बेटा राइट सो क्वेश्चन नंबर 431 छै emulsifications of lipid in the small intestine requires ऑप्शन छै gastric lipase ऑप्शन बी छै pepsin ऑप्शन सी छै pancreatic lipase ऑप्शन डी छै bile salts so which option is the correct answer which option is the correct answer beta which option is the correct answer so correct answer is bile salt right emulsifications of lipids in the small intestine requires bile salt right requires bile salt next question question number 432 is identify the proteolytic enzyme present in the gastric juice identify the proteolytic enzyme present in the gastric juice option A रचे peptidase option B रचे trypsin option C रचे chymotrypsin option D रचे pepsin so which option is the correct answer बेटा फटाफट के आंसर कर लो so correct answer कौन होगा बेटा pepsin होगा right pepsin is the proteolytic enzyme present in the gastric juice pepsin is the proteolytic enzymes present in the gastric juice next question number 433 रचे what is the first steps in the aerobic glycolysis sequence pathway is what is the first step in the aerobic glycolysis sequence pathway is option A glucose 6 phosphatase glucose 6 phosphate option B fructokinase option C pyruvate option D fructose 6 phosphate so which option is the correct answer beta which option is the correct answer So correct answer is option A. Very good, Jaskitan Jinda. Option A is the correct answer, right? Glucose 6 phosphate. Right, glucose 6 phosphate. The first steps in the aerobic glycolysis sequence pathway is first one is the glucose 6 phosphate. Glucose 6 phosphate, right? Option A is the correct answer. Next question number 434. The process of synthesis of glucose from a non-carbohydrate source is called option A lipogenesis, option B glycogenesis, option C gluconeogenesis, option D glycogenolysis. So which option is the correct answer, beta? The process of synthesis of glucose from a non-carbohydrate source is called what? Gluconeogenesis. Option C is the correct answer, right? Now the process of synthesis of glucose from a non-carbohydrate source is called gluconeogenesis. Option C is the correct answer. Next question number 435, which is secondary bile acid is option A taurocolate, option B colic acid, option C lithocolic acid, option D canodioxycolic acid. So which option is the correct answer beta? फटाफट आंसर कर देलो बेटा जो मैंने भी एबे लाइव क्लास देखुचो काली सकाळ 10 AM रे संडे काली ना संडे क्लास बेटा दुई थर आसीबा सेशन संडे क्लास शेड्यूल बेटा संडे क्लास शेड्यूल हैला 10 AM रे फर्स्ट सेशन एंड 4 PM रे सेकंड सेशन राइट 10 AM रे फर्स्ट सेशन 4 PM रे सेकंड सेशन प्लीज जॉइन हे जिबा समझते राइट ना तो समझते जॉइन हे जिबा आसंता काली मॉर्निंग टाइम 10 AM रे एंड इवनिंग टाइम रे 4 PM रे राइट so correct answer is lithocholic acid beta secondary bile acid is known as lithocholic acid right and this is the secondary bile acid right cholic acid and canodioxycholic acid beta this is the primary bile ये cholic acid and canodioxycholic acid is these both are primary bile beta primary bile acid and lithocholic acid is the secondary bile acid right ठीक ना नेक्स्ट क्वेश्चन नंबर 436 which is the largest serous membrane of the body beta which is the largest serous membrane of the body peritoneum option B mucosa option C serosa option D mucosa so which option is the correct answer submucosa peritoneum mucosa serosa submucosa so which option is the correct answer so correct answer is peritoneum is the largest serous membrane of the body largest serous membrane of the body that is peritoneum option A is the correct answer right next question number 437 breakdown of glycogen to glucose is known as option A glycolysis option B proteolysis option C glycogenolysis option D proteogenolysis so which option is the correct answer beta so correct answer is glycogenolysis is the correct answer option C is the correct answer glycogenolysis is the correct answer so glycogenolysis is the breakdown of glycogen to glucose breakdown of glycogen to glucose is known as glycogenolysis breakdown of glycogen to glucose is known as glycogenolysis option C is the correct answer right option C is the correct answer next question number 438 the larynx is closed during swallowing by option A epiglottis option B cricoid cartilage option C vocal cord option D thyroid cartilage so which option is the correct answer फटाफट आंसर कर दिया which option is the correct answer बेटा which option is the correct answer so correct answer is option A epiglottis right ना मैं पूर्व पढ़ी थी है ना the larynx is closed during swallowing by epiglottis next question number 439 bile salts are important for digestion of dash option A fat option B protein option C carbohydrate option D iron so which option is the correct answer beta so correct answer is option A bile salts are important for digestion of fat right digestion of fat next question number 440 which one of the following is a function of the liver which one of the following is a function of the liver option A synthesis of plasma protein option B elimination of carbohydrates option C concentration of bile option D secretions of cholecystokinin which one of the following is a functions of the liver option A synthesis of plasma protein option B elimination of carbohydrate option C concentration of bile option D secretion of cholecystokinin so which option is the correct answer beta so correct answer is option A synthesis of plasma protein is functions of liver synthesis of plasma protein is one of the functions of the liver so option A is the correct answer next question beta Question number 441 is in the liver bacteria that found their way into portal circulation is destroyed by. So in the liver bacteria that found their way into portal circulation is destroyed by option A is Kupffer cells, option B is cilia, option C is hydrochloric acid, option D is leukocytosis. So which option is the correct answer? So correct answer is beta option A, Kupffer cells, right? In the liver bacteria that found their way into portal circulation is destroyed by Kupffer cells, right? Kupffer cells. Option A is the correct answer. Very good. Option A is the correct answer. Next question, question number 442. Proton form in stomach is an example for. Proton form in stomach is an example for. Option A is simple diffusion. Option B is facilitated diffusion. Option C is primary active transport. Option D is secondary active transport. So which option is the correct answer? Beta, which option is the correct answer? So correct answer is option C is the correct answer. Primary active transport is the correct answer, beta. Right? Next question, question number 443 अच्छी बेटा बेटा कल 10 AM रे समस्ते जॉइन है जिबा 10 AM रे फर्स्ट क्लास अच्छी संडे रे देन 4 PM रे अच्छी बेटा सेकंड सेशन राइट 4 PM रे सेकंड सेशन फर्स्ट सेशन कल दीटा सेशन संडे दिन फर्स्ट सेशन रे बेटा 10 AM रे क्लास हबो देन सेकंड सेशन रे 4 PM रे क्लास हबो समस्ते सकाळ जॉइन है जिबा एंड संडे रे भी जॉइन हबो बेटा राइट So question number 443 is pepsinogen in the stomach is secreted by option A goblet cells, option B G cells, option C parietal cells, option D chief cells. So which option is the correct answer beta? Most important MCQ, right? These सब questions आसिबो बेटा important MCQ जोटा आमे डिस्कशन करूचे प्रत्येक टी क्लास रे तो प्रत्येक टी वीडियो आम पई इंपोर्टेंस हैला. So which option is the correct answer? Which option is the correct answer? फटाफट के आंसर कर दिया. So correct answer is beta chief cells, right? Chief cells is the correct answer. So pepsinogen in the stomach is secreted by chief cells, right? Chief cells in the stomach, right? Chief cell, very good. Next question, question number 444. Adult based metabolic rate decrease with an increase in option A muscles mass, option B fever, option C body fat, option D body surface area. So which option is the correct answer? Adult based metabolic rate decrease with an increase in body fat, right? Option C, very good. Option C only correct answer. Next question, question number 445. The pathway through which a cell produces the maximum number of ATP molecule is. Option A pentose phosphate pathway, option B glycolysis, option C lactic acid fermentation, option D TCA or Krebs cycles. So which option is the correct answer? So correct answer is beta TCA cycles or citric acid cycle भी कहा जाएगा. Citric acid cycle भी कहा जाए citric acid cycle, right? TCA cycle, Krebs cycle और citric acid cycle मध्य कहा जाए. This is the series of chemical reaction that occurs in the mitochondria of eukaryotic cells, right? And which is a cell produce the maximum number of ATP molecules. Option D is the correct answer. Very good. Option D is the correct answer. Option D is the correct answer. Beta next question, question number 446. Most important MCQ, the most important MCQ 5 stars questions, right? 5 star दे दोची. Next question, question number 446. Ketone bodies are synthesized from option A acetyl coenzyme A, option B cholesterol, option C phospholipids, option D triglycerides. So which option is the correct answer? So correct answer is, which one is the correct answer beta? So correct answer is option A, acetyl coenzyme A is the correct answer, right? Next question, question number 447. How many pairs of salivary glands are there? Most important MCQ, most important MCQ exam point of view. how many pairs of salivary glands are there? Option A is 2 pairs, option B is 3 pairs, option C is 4 pairs, option D is 5 pairs. So which option is the correct answer? फटाफट आंसर कर देला. So correct answer is Surya Narayan Pati. Very good. Option 3 is 3 pairs only. Option B is the correct answer. Beta, option B is the correct answer. 3 pairs of major salivary glands in humans, right now. So 3 pairs of salivary glands are in human, right now. कौन कौन सा बेटा? पेरोटिड्स, then beta submandibular, and और कौन बेटा? sublingual glands. These are the 3 pairs of major salivary glands in human. These are the parotids, submandibular, sublingual glands, right? Next questions. Cecum, colon and rectum are a part of option is small intestine, option B is large intestine, option C is pleural cavity, option D is peritoneum. So which option is the correct answer? बेटा फटाफट आंसर कर दो. Which option is the correct answer? फटाफट आंसर कर दियो. Which option is the correct answer? So correct answer is option B, large intestine. Option B, very good. Bhavna Saini, madam, very good. Option B only correct answer. Bhavna Saini, Monalisha Malik, Surya Narayan Pati, Lalita Mahanand, Jaskitan Chinda, Dharati Das, Archana Goda. Very good. Option B only correct answer right now. Next question, question number 449 is islet of Langerhans are rich in which part of pancreas? Option is body, option is head, option is tail, option is neck. Most important MCQ beta, most important MCQ for your upcoming USSSC nursing officers exam. So which option is the correct answer? Islet Langerhans are rich in which part of pancreas? So which option is the correct answer? फटाफट आंसर कर दिया, फटाफट आंसर कर दिया. So correct answer is option C is the correct answer. Tail only, beta, tail. So islets are most evident in the tail of the pancreas, right now beta. Tail have a correct answer. Tail is the correct answer beta. Next question, question number 450. The cells of gastric gland that secretes hypochloric acid found in gastric juice are called. Option A is neck cells, option B is cheap cells, option C is parietal cells, option D is mucus cells. So which option is the correct answer? The cells of gastric gland that secretes hydrochloric acids found in gastric juice are called. Option A is neck cells, option B is cheap cells, option C is the parietal cells, option D is mucus cells. So which option is the correct answer? Which option is the correct answer? So correct answer is parietal cells. Very good. Option C only correct answer, parietal cells. Next question, question number 451. A prudent nurse knows that the most of nutrients is absorbed in option is large intestine, option is small intestine, option is esophagus, option is rectum. So which option is the correct answer? वेरी गुड सूर्य नारायण पति बेटा, वेरी गुड, बहुत बढ़िया. ऑप्शन बी ओनली करेक्ट आंसर. स्मॉल इंटेस्टाइन रे न्यूट्रिएंट एब्जॉर्प्शंस हुए, राइट ना, न्यूट्रिएंट एब्जॉर्प्शन इन स्मॉल इंटेस्टाइन, राइट. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 452 रचे ऑल ऑफ द फॉलोइंग द फंक्शंस कैरी आउट बाय द स्टोमक एक्सेप्ट. ऑप्शन ए रे अछि एब्जॉर्प्शन ऑफ विटामिन B12 इन स्टोमक्स, right. Option B is GIT enzyme, option C is acid secretions, option D is gastrointestinal motility. So which option is the correct answer? So correct answer kanamba option A is the correct answer. Absorption of vitamin B12 in stomach is wrong haba, right. Absorption of vitamin B12 in small intestine, in small intestine, right? Option A is the correct answer. Very good. Option A is the lock किया जाए, right ना? Option A को lock किया जाए. So option A is the correct answer. Next question, question number 453 functions of gastric juice except option A help in digestion of food, option B to produce mucus, option C absorption of water, option D activation of salivary gland. So which option is the correct answer? So correct answer is activation of salivary glands beta. Option D is the correct answer. Functions of gastric juice except koichi, right? Activation of salivary gland. This is not the functions of gastric juice, right? This is not the functions of gastric juice. So help in digestion food, that is the functions of gastric juice. To produce mucus, that is the functions of gastric juice. Absorption of water, that is the functions of gastric juice. So option D is the correct answer. Option D, activation of salivary gland. This is not the functions of gastric juice. Right now, next questions. Question number 454. Which one of the following structure is not present in the stomach bed? Option A, hepatic flexor of colon. Option B, left suprarenal gland. Option C, splenic flexor of colon. Option D, pancreas. So which option is the correct answer? So which option is the correct answer? फटाफट answer कर दिला. So correct answer is option A. Right now, correct answer is option A, hepatic flexor of colon. So the stomach bed refers to the structure that lie posterior to the stomach and form its an anatomical support. And this structure include beta cons, left suprarenal gland, splenic flexor of colon, and pancreas. These three are the anatomical support structure of this stomach bed, right now. So hepatic flexor of colon not present in the stomach bed, right? So option A is the correct answer. Next question, question number 455. Which of the following statement is incorrect with respect to portal vein? Which of the following statement is incorrect with respect to portal vein? Option A, portal blood is rich in nutrients. Option B, portal blood is rich in oxygen. Option C, portal blood comes from the gastrointestinal system. Option D, portal circulation constitute 80% of the circulation to the liver. So which option is the correct answer? So correct answer is beta option B is the correct answer, right? Option B is the correct answer. Incorrect with the respect to portal vein causes. So portal blood is rich in oxygen. This is incorrect statement, right? This is incorrect statement. Say option B is the correct answer. Baki the portal blood is rich in nutrients. This is the correct with respect to portal vein. Then portal blood comes from the gastrointestinal system. Option D is portal circulation constitute 80% of circulation to the liver. These all are the correct with respect to portal vein, right now. So option B is the correct answer. Next question, question number 456. Which of the following is not included in the liver function test? Not included in the liver function test, or LFT, right now. Option is prothrombin time. Option is prothrombin time, that is PT. Option is albumin. Option C is pepsin. Option D is bilirubin. So which option is the correct answer, beta? Which option is the correct answer? फटाफट आंसर कर देला. Correct answer is option C. Very good, Mona Lisa Malik. Option C is the correct answer. Pepsin is the correct answer, right now. Pepsin is not included in a liver function test, right? Next question, question number 457. The right free border of laser omentum. The right free border of laser omentum contains all the following structure except. Option is bile duct. Option is portal vein. Option C is hepatic artery. Option D is inferior vena cava. So which option is the correct answer? So correct answer is inferior vena cava, all are the right now beta inferior vena cava hobo nahi, right? So right free border of lesser omentum contains all the following structures, means bile duct, portal vein and hepatic artery. These all are the right free border of lesser omentums, and this contains all the following structure beta bile duct, portal vein, hepatic artery छाड़ी के inferior vena cava को छोड़ के बाकी सब all are the structures of the right free border of lesser omentum, right? Next question number 458 is largest organ of human body. Each option is skin, option B is bone, option C is stomach, option D is liver. So which option is the correct answer? Largest organ of the human body. फटाफट के आंसर कर दो. Largest organ of the human body. Largest organ of the human body. Option A, skin is the correct answer, right? Skin is the largest organ of human body. Largest organ of the human body is the skin. Right, next question number 459. Next question number 459. What is the superficial layer of skin called? Option which is sebaceous glands, option which is epidermis, option C which is dermis, option D which is hair. So which option is the correct answer? Which option is the correct answer, beta? So correct answer is epidermis, right? Epidermis is the superficial layer of the skin, right? And superficial layer of the skin is called epidermis, right? And this is the outermost layer of the skin, outermost layer of the skin, outermost layer of the skin. Right, next question number 460. Which layer of the skin is involved in cellulitis? Option is hypodermis, option is hypodermis and dermis, option is epidermis and dermis, option is dermis, option is affected epidermis and dermis due to staphylococcus. Affected epidermis and dermis due to staphylococcus. So which option is the correct answer, beta? So correct answer is dermis. So dermis layer of the skin is involved in cellulitis. Right, dermis. So most important MCQ mane rakhita. So cellulitis को layer of the skin रे होची बेटा cellulitis dermis रे होची नहीं. So correct answer is option C. Option C is the correct answer. Option C is the correct answer. Next question number 461. Which of the following help prevent water loss through skin? Which of the following help prevent water loss through skin? So correct answer is which option? Option is melanin, option is keratin, option C is keratin, option D is collagen. So which option is the correct answer, beta? So correct answer is option C, keratin. Keratin helps prevent water loss through skin, right? Keratin is the correct answer. Right, next question number 462 रची बेटा मैं scenario based questions किछि देखिबा. So the nurse who was performing a cardiovascular assessment of an adult male patient. The nurse was performing a cardiovascular assessment of an adult patient. Where will she find the aortic area? Where will she find the aortic area? Option A is the fourth intercostal space in the left sternal border. Option B is the second intercostal space in the left sternal border. Option C is the fifth intercostal space in the mid-clavicular line. Option D is the second intercostal space in the right sternal border. So which option is the correct answer, beta? So correct answer is option D. The second intercostal space in the right sternal border is the correct answer, right? So option D is the correct answer, beta. So fifth intercostal space in the mid-clavicular line, that is mitral area, beta. This is mitral area, right? The second intercostal space in the left sternal border, that is pulmonary area, right now. Then the fourth intercostal space in the left sternal border, that is tricuspid area, tricuspid area. And the second intercostal space in the right sternal border is which area beta? Aortic area, aortic area, aortic area. So option D is the correct answer beta. Next question, question number 463. When assessing the lower extremities for arterial functions, which interventions should the nurse perform? Option A, assessing the medical malleus for pitting edema. Option B, performing Allen test. Option C, assessing the Humans test. Option D, palpating the pedal pulse. So which option is the correct answer? फटाफट आंसर कर देला. So correct answer कौन होगा? Palpating the pedal pulses होगा. Palpating the pedal pulses or dorsalis pedis or posterior tibia ये हमें pedal pulse देखुचे. कोठी हमें देखुचे dorsalis pedis and posterior tibia हाँ ना नहीं. And this is direct and essential method to assess arterial blood flow and perfusion in the lower extremities, right now beta. So correct answer is option D is the correct answer, right? Next question, question number 664. A client is admitted to the ward at 4 p.m. A client is admitted to the ward at 4 p.m. She is posted for hemorrhoidectomy. The next day morning, the nurse is expected to record the assessment of her vital signs before checking the blood pressure. The most important principle the nurse has to follow is option A, prepare the equipment and supplies. Option B, explain the procedure to the client. Option C, wash hand. Option D, position the clients. So which option is the correct answer? किसी भी प्रोसीजर करबा आगुरु है ना नहीं तो आमे कौन करूचे बेटा प्रोसीजर को एक्सप्लेन करूचे पेशेंट को है ना एक्सप्लेन द प्रोसीजर टू द पेशेंट्स है ना नहीं सो करेक्ट आंसर कौन होगा ऑप्शन बी इज द करेक्ट आंसर राइट ना ऑप्शन बी इज द करेक्ट आंसर एक्सप्लेन द प्रोसीजर टू द पेशेंट्स है ना नहीं एक्सप्लेन द प्रोसीजर टू द patient. Option B is the correct answer. Next question, question number 465 रची. While assessing a patient's cranial nerves, the nurse asks the patient to raise the eyebrow. While assessing a patient's cranial nerves, the nurse asks the patient to raise the eyebrows, smile, and show the teeth to assess which cranial nerve. Option A is auditory, option B is olfactory, option C is facial, option D is optics. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is option C, facial. No, facial is the correct answer. Facial nerve कितने बेटा को cranial nerve is V3rd means 8th cranial nerve is facial nerve beta. Facial nerve is also known as 8th cranial nerve, right now cranial nerve 8th. Next question, question number 466 rachi beta. Which of the following side is assessed to check pedal pulse? Which of the following side is assessed to check pedal pulse? Option A is behind the knee, option B is on the foot, option C is below medial malleus, option D is on the heart. So which option is the correct answer? yes बेटा सॉरी 8th cranial nerve होगा नहीं बेटा 7th cranial nerve right 8th cranial nerve is a vestibulocochlear nerve right this is responsible for auditory hearing हाँ ना नहीं sorry 7th cranial nerve facial nerve is otherwise known as cranial nerve 7 right very good बेटा सूर्य नारायण right and cranial nerve 8 ही जीतिले कौन है तांता that is vestibulocochlear nerve ही तांता बेटा for hearing only नहीं ओ ठीक है right thank you very good बहुत बढ़िया good participations next question number 466 which of the following site is assessed to check pedal pulse option is behind the knee option B is on the foot next behind the knee option B is on the foot option C is below medial malleus option D is on the heart so which option is the correct answer beta which option is the correct answer which option is the correct answer so on the foot have a correct answer right now the pedal pulse refers to the pulse felt in the foot right pulse felt in the foot the correct answer is option B next question बेटा microbiology रे किछि क्वेश्चंस देखिबा तापर क्लास एंड करबा राइट ना which of the following is the most common pathogen causing urinary tract infections option is Klebsiella option is Pseudomonas option is E. coli option is Proteus so which option is the correct answer beta which option is the correct answer the correct answer is option C very good E. coli hebo so which of the following is the most common pathogen causing urinary tract infections option C is the correct answer E. coli option C is the correct answer next question number 2 रे अछि बेटा which of the following is an enriched culture medium primarily used for growing fastidious bacteria such as Haemophilus and Neisseria so option A रे अछि blood agar option B रे अछि nutrient agar option C रे chocolate agar option D रे savu rod agar so which option is the correct answer blood agar nutrient agar chocolate agar and sav-rod agar so which option is the correct answer so correct answer is chocolate agar beta chocolate agar is an enriched culture medium primarily used for growing fastidious bacteria such as Haemophilus and Neisseria right so option C is the correct answer next question number 3 रे अछि microbiology रा question number 3 रे अछि बेटा the process of macrophages engulfs the microorganisms and cellular debris refers to most important MCQ हला 5 star MCQ ये हला माइक्रोबायोलॉजी रा 5 स्टार एमसीक्यू बेटा द प्रोसेस ऑफ माइक्रोफेजेस एनगल्फ्स द माइक्रोऑर्गेनिजम्स एंड सेलुलर डेब्रिस फॉर्म रेफर्स टू ऑप्शन है थ्रोम्बोपोइसिस ऑप्शन बी है ल्यूकोपोइसिस ऑप्शन सी है फागोसाइटोसिस ऑप्शन है प्रोपल्सन सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा so correct answer is phagocytosis option C is the correct answer very good option C is the correct answer next question number 4 is the microbes that use chemical compounds as a source of energy are known as option है chemotrophs option B है organotrophs option C है lithotrophs option D है phototrophs so which option is the correct answer so correct answer is chemotrophs option A is the correct answer chemotrophs the microbes that use chemical compounds as a source of energy are known as chemotrophs right microorganisms that use chemical compounds as a source of energy are known as chemotrophs right option A is the correct answer next question number 5 रछि causative organism for tuberculosis causative organism of tuberculosis फटाफट आंसर कर दे बिना देरी करके and निर्भुल भाବରେ causative organisms for tuberculosis is option है mycobacteria option C है chlamydia option C है E. coli option D है mycobacterium tuberculosis so which option is the correct answer so correct answer is option D mycobacterium tuberculosis right causative organisms of tuberculosis is mycobacterium tuberculosis next question number 6 the pH range that supports optimal growth for most bacteria is The pH range that support optimal growth for most bacteria is dash. Option B 7.2 to 7.6. Option B 4.2 to 5.2. Option C 3.2 to 6.2. Option D 2.5 to 3.5. So correct answer कौन बेटा? So correct answer is option A 7.2 to 7.6 रे कौन होची optimal growth for most bacteria. है ना? The pH range that supports optimal growth for most bacteria is 7.2 to 7.6. Option A is the correct answer. Next question, question number 7 अच्छे. The microbes that can grow at pH below 5 are known as. Option अच्छे alkiphiles. Option B अच्छे acidophiles. Option C अच्छे mesophiles. Option D अच्छे halophiles. The microbes that can grow at pH below 5 are known as alkaliphiles. Option B रचे acidophiles. Option C रचे mesophiles. Option D रचे halophiles. So which option is the correct answer beta? So correct answer is which option? So correct answer is which option? Correct answer is beta acidophiles, right? Acidophiles. Option B is the correct answer. Acidophiles. Very good. Acidophiles is the correct answer. The microbes that can grow at pH below 5 are known as acidophiles. Suman means acidophiles. Kusum sober 5. Epic creations. Lipun marked option B. Very good beta. Option B is the correct answer. Next question, question number 8. Streptococcus pneumonia is a dash type of bacteria. Streptococcus pneumonia is a dash type of bacteria. Option is gram negative bacilli. Option B is gram positive cocci. Option C is gram positive bacilli. Option D is gram negative cocci. So which option is the correct answer? So फटाफट answer कर दिया. Correct answer is beta Streptococcus pneumonia is a gram positive cocci. This is the type of bacteria, right? Gram positive bacteria, gram positive cocci bacteria. So option B is the correct answer. Option B is the correct answer. Next question, question number 9. Which of the following phases of bacterial growth is characterized by rapid exponential cell division where the population increases at a constant rate? Option is stationary phase. Option B is log phase. Option D is lag phase. Option D is death phase. Which of the following phases of bacterial growth is characterized by rapid exponential cell division where the population increases at a constant rate? So which option is the correct answer? Sorry beta. Which option is the correct answer beta? Correct answer is option B, log phase. Right now, the phase of bacterial growth characterized by rapid exponential cell division where the population increases at a constant rate is called log phase or exponential phase. Log phase or exponential phase. Log phase or exponential phase. Exponential phase, right? So during log phase, bacteria divide rapidly and doubling their population at a constant rate, right? During log phase, bacteria doubling and divide rapidly, right? Now beta option B is the correct answer. Next question, question number 10. Gill-Nelson acid fast staining method is commonly used to demonstrate. Option is Mycobacterium tuberculosis. Most important MCQ asuchi beta 8 type of questions. 5-star questions right now. So Gill-Nelson acid fast staining method is commonly used to demonstrate. Option is Mycobacterium tuberculosis. Option is Klebsiella pneumonia. Option is Escherichia coli. Option D is Corneobacterium diphtheria. So which option is the correct answer? Correct answer is beta option A, Mycobacterium tuberculosis. Right? Acid fast staining specially detects for bacteria with thick waxy cell wall such as Mycobacterium tuberculosis. Right now, so this stain is used for commonly used to demonstrate Mycobacterium tuberculosis. Right. So option A is the correct answer. Beta. Next question, question number 11. SARS. SARS option is a single strand RNA virus. Most important MCQ. SARS is single strand RNA virus. Option B is a double strand RNA virus. Option C is a single strand DNA virus. Option D is double strand DNA virus. So which option is the correct answer beta? So correct answer is option A, single strand RNA virus, right? SARS so full form कौन बेटा? Severe acute respiratory syndrome, severe acute respiratory syndrome, right now, and this is caused by a single strand RNA virus, SARS-CoV virus or SARS coronavirus, and this virus responsible for SARS or SARS-CoV or SARS coronavirus, and this is single stranded RNA virus or genome, right now. So coronavirus or single stranded RNA virus or RNA genome beta, right? बुझी पाला ना? coronavirus or single strand RNA virus or genome, right now. Next question number 12 रे अच्छी बेटा, the proportion of clinical cases resulting in severe clinical manifestation is known as, option A ineffectively, option B virulence, option C pathogenicity, option D prepathogenesis. So which option is the correct answer? Which option is the correct answer? The proportion of clinical cases resulting in severe clinical manifestation is known as infectivity, option B virulence, option C pathogenicity, option D prepathogenesis. So which option is the correct answer beta? So correct answer is virulence, right? Option B is the correct answer. Virulence is defined as what beta? The degree of pathogenicity of a pathogen like bacteria, fungi, viruses, and this is determined by to its ability to invade or multiply within the host. So correct answer is option B, right? This is the proportions of clinical cases resulting in severe clinical manifestation is known as virulence. Option B is the correct answer. Right. Next question number 13 who discover virus in biology? Most important MCQ, फटाफट आंसर कर दे बेटा. Who discovered virus in biology? Option A Edward Jenner, option B Robert Hooke, option C Robert Koch, option D Dmitry Ivanskaya. Very good. Option D is the correct answer. Option D is the correct answer. So Edward Jenner कौन करते बेटा? He created the smallpox vaccine. He created by smallpox vaccines, right? Right. And Robert Koch discovered the cells. Discovered the cell and discovered the cause of tuberculosis. Right? Not tuberculosis. Sorry. Robert Hooke discovered the cell. Sorry, beta. And Robert Koch discovered the cause of tuberculosis, right? Robert Hooke discovered the cell. Sorry. Koch and Hooke. Confusion. Don't confuse beta. Robert Hooke discovered the cell, right now. And Robert Koch discovered the cause of tuberculosis, right now. Edward Jenner created smallpox vaccines. Robert Hooke discovered the cell. Robert Koch discovered the cause of tuberculosis, and Dmitry Ivanskaya discovered the virus in biology, right? Next question number 14. Which of these these it's a virus. Option A is Treponema pallidum, option B is Candida albicans, option C is helminths, option D is varicella zoster. So which option is the correct answer beta? फटाफट आंसर कर दिया. Which option is the correct answer? So option D is the correct answer. Varicella zoster. Varicella zoster is a DNA virus beta, DNA virus. Right now, varicella zoster is a DNA virus and it causes chicken pox. It causes chicken pox. हाँ ना ना chicken pox. It causes chicken pox. हाँ ना. So Treponema pallidum causes what beta? Syphilis. Syphilis. माने रखते बेटा causative organisms सहित questions आसुची. Syphilis. Treponema pallidum causes syphilis. And syphilis रा causative organisms होची Treponema pallidum. Candida albicans causes infections. हाँ ना नहीं. Candida albicans is a fungus and that can cause infections. This is a fungus beta and it causes infections. And helminths is a what beta? Helminths is a parasitic worms. Parasitic worms, right? Parasitic worms. All about Treponema pallidum, Candida albicans, helminths, and varicella zoster. Right now. So question number 14. Which of these a virus, that is varicella zoster? Right. Option D is the correct answer. Next question number 15. The person or animals who has been infected with an adult or sexual form of pathogen is called. Option A definitive host, option B indefinitive host, option C intermediate host, option D mediate host. So which option is the correct answer? So correct answer is option A, right? Definitive host beta. Definitive host is the correct answer. The term for a person or animal infected with the adult or sexual stage of a pathogen is definitive host beta, or sexual stage. Sexual stage of a pathogen is definitive host. है ना नहीं? Sexual stage of a pathogen is a definitive host. The term for a person or animal infected with the adult or sexual stage of a pathogen is a definitive host beta. Option A is the correct answer, right? Next question number 16. Sporulation occurs at which stage of bacterial growth curve? Sporulation occurs at which stage of bacterial growth curve? Option A lag phase, option B log phase, option C stationary phase, option D phase of decline. So which option is the correct answer beta? So correct answer is which phase? Stationary phase, right? Now option C is the correct answer. Sporulation is the formation of end spores in bacteria primarily during the stationary phase of bacterial growth curve, right? So stationary phase of beta correct answer. Next question number 17. Which of the following bacterial structure is involved in attachment to cell structure? Option A flagella, option B fimbria, option C capsule, option D mesosomes. So which option is the correct answer? So correct answer is B have a beta. Option B is the correct answer. Fimbria or small hair-like structure. Fimbria or small hair-like structure. Small hair-like structure. Right now. Small hair-like structure on the surface of the bacteria. On the surface of the bacteria that facilitate attachment to host cell or other surface. Right now beta. So correct answer is option B. Next question number 18 is what is the nutritional class of fungi according to the Whittaker's five kingdom concept? What is the nutritional class of fungi according to the Whittaker's five kingdom concept? As option A रचे phototrophic, option B रचे chemoautotrophic, option C रचे heterotrophic, option D रचे homeotrophic. So which option is the correct answer? So correct answer is heterotrophic, right? Option C is the correct answer. Right, option C is the correct answer. Next question, question number 19 rachi. Which among the following belongs to which among the following belongs to dsRNA virus? Option rachi rice dwarf, option B rachi rhabdovirus, option C rachi mosaic virus, option D rachi papa virus caused. Which option is the correct answer, beta? Which option is the correct answer? So correct answer is rice dwarf is the correct answer. So rice dwarf virus is a plant virus. This is a plant virus. Beta, this is a plant virus, right? And this is known to have a double stranded RNA. This is double stranded RNA. Double stranded RNA or dsRNA virus, right? So rice dwarf is the correct answer, beta. Rhabdovirus, this is single stranded RNA. This is single stranded RNA. Single stranded RNA, right? Mosaic virus, beta, this is not a specific virus. This is a symptoms, right? This is a symptoms caused by various virus, right? This is a mosaic virus. This is symptoms and it is caused by various virus. And papa virus caused. The papa virus is a family virus with double stranded DNA virus, right? Double stranded DNA genome or virus, DNA genome or virus, right? So this is a family of viruses. This is a family of viruses. This is a family of viruses, right? This is all about beta question number 19. So correct answer is option A, rice dwarf. Next question, question number 20. What is the shape of Bacillus tuberculosis bacteria? What is the shape of Bacillus tuberculosis bacteria? Option A ellipsoidal or spherical, option B filamentous, option C rod shaped, option D vibrio or coma. So which option is the correct answer, beta? So correct answer is rod shaped, right? Rod shaped of Bacillus tuberculosis bacteria. Bacillus tuberculosis bacteria are rod shaped morphology. Rod shaped morphology, right? Rod shaped morphology. right ना बेटा नेक्स्ट आसना कल बेटा 10 AM रे देखा हबो संडे 10 AM right please all are join at 10 AM morning right and 4 PM evening sessions right please all are join in time बेटा so thank you so much बेटा जो मैंने भी देखु छ कंसंट्रेट करे की so निहाती भाव जड़े निहाती भाव भल नर्सिंग ऑफिसर हम बोले मोर आशा एंड विश्वास एंड ऑल ब्लेसिंग टू ऑल ऑफ यू बेटा फ्रॉम माय कोर ऑफ हार्ट हृदय सहित तुम को ब्लेसिंग करुच्ची भगवान को डाकुची निहाती भाव जड़े नर्सिंग ऑफिसर से बेटा राइट ना सो आजिकार एक क्लास तुम को हेल्पफुल होता बोले मोर आशा और विश्वास निहाती भाव मैंने क्लासेस देखी किसी ना कि बेनिफिट पाई बोले मोर आशा बेटा आज टी मत भल लगुनि काली क्लास करवा तो रेस्ट कले काली सका उठी क्लास कर पारे बेटा राइट ना खाई पी कि जल्दी मत शोवा पड़ो राइट तो मॉर्निंग रे मैं क्लासेस करवा 10 AM मॉर्निंग रे देन 4 PM रे बेटा भल लगुनि ना मैं कंटिन्यूअसली करी बेटा 10टा जाए क्लास करी 10 PM जाए क्लास करी बट दैट भल लगुनि राइट भल लगुनि फिर भी क्लास नहीं कहीं क्लास जदि बेटा कंटिन्यूअसली करवानी आम जो टार्गेट अच्छी 10,000 मोस्ट इंपोर्टेंट एमसीक्यू प्रत्येक एग्जामिनेशन जो आउसी से मोस्ट इंपोर्टेंट एमसीक्यू आमे कवर अप करछे हमर ए महा मैराथन क्लास रे बेटा मोस्ट इंपोर्टेंट एमसीक्यू सब आमे कवर अप करूचे सो निहाती भाबरे तुम मानकर अपकमिंग OSSC नर्सिंग ऑफिसर एग्जाम पाई हेल्पफुल हबो निहाती भाबरे प्रत्येक टी सेशन रे आसकी जॉइन हो बेटा किछि ना किछि मोर मु जहा जानि छी बेटा जहा ये करछि किछि भूल भाल हबो किछि तमे जानि जे एक्स्ट्रा किछि मु जहा जानि छी सेटा शेयर करबी बेटा इन द क्लास सेशन निहाती भाबरे तमे भी पाठ पढिछ बेटा बिना पाठरे तो तमे नर्सिंग ऑफिसर हबोनी ना फिर भी बेटा मु जहा जानि छी व्हाटएवर आई लर्न आई शेयर विथ यू बेटा तुम मान सहित शेयर करी है ना नहीं सो निहाती भाव में क्लास लाइव क्लास सेशन रे आस जॉइन हुआ बेटा मुझे जहाँ जानी जो जो क्वेश्चंस मुझा देखी प्रत्येक एग्जाम रे से सब तुम मान सहित शेयर करुच्ची मुझे जहाँ पढ़ी किसी भूल होता है आम करेक्शंस करवा है ना नहीं सो बेटा थैंक यू सो मच वन एंड ऑल वंस अगेन सो जो मैंने फर्स्ट टाइम चैनल को देखो सब्सक्राइब करके रखी दियो एवं वीडियो को लाइक कर दियो एवं शेयर कर दियो जेमती तुम मान सांग मैंने आम क्लास से जॉइन हो पारि थैंक यू सो मच आज का क्लास रे एतिकी बेटा टेक केयर ऑल द बेस्ट की स्टे मोटिवेटेड एंड स्टे ऑलवेज पॉजिटिव बेटा स्टे ऑलवेज पॉजिटिव निहाती भाव नर्सिंग ऑफिसर हो बेटा बहुत सारा पोस्ट अच्छी 6,000 अप्रोक्सीमेटली 6,000 पोस्ट अच्छी बेटा निहाती भाव में गोटे पोस्ट तुम अच्छी जस्ट आमको पाठ पढ़ार अच्छी एवं मेहनत करार अच्छी जब बिना पढ़ी जाकि परीक्षा रे जय गणेश करके हमको गोल बुलेले हबनी बेटा कि ऑप्शन चूज कले हबनी कि एलिमिनेशन मेथड यूज करके हमको क्वेश्चंस आंसर कले हबनी निहाती भाव में हमको पढ़ी की जीवा पड़ो मैक्सिमम 10,000 एबोव एमसीक्यू हमको देखिकी जीवा पड़ो दैट इज आवर टारगेट बेटा राइट ना थैंक यू सो मच एंड टेक केयर बेटा एंड टाटा बाय बाय बेटा।